Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Today we're going to talk about colic. Please remember that these videos are not intended to replace your visits with your pediatrician. If you're concerned about your child, make an appointment to be seen. We're happy to see you here in our office, area code 775-359-7111. We'll get you in the same day if we need to. So colic, what is it? Who has it? This is a disease that a lot of parents self-diagnose, sometimes correctly, sometimes incorrectly. It's a disease disease state that's characterized by a very fussy, irritable infant, often associated with a lot of gas and burping and spitting up. Usually we start to see it around 2 weeks of age, usually peaks about 2 months of age, then little by little goes away. It can take up to 6 months to disappear. So patience for this is a virtue. These kids with colic tend to scream, and they will scream and shriek bloody murder. You will, as a parent, be certain your child is dying because they're just inconsolable, miserable children. This usually starts in the mid to late afternoon, so 3, 4, 5 o'clock, and continues to the early evening hours. However, it does not interrupt sleep. If your child does not sleep because of this, or your child does not eat because of this, this is not colic. With the colic, the kids can swallow a lot of air, but their belly shouldn't be really tense or distended. It should be nice and soft. They should not be running fevers. If they're having fevers, this is absolutely not colic. It can be mimicked by a bunch of other diseases, and these are things that you may need help ruling out, including all kinds of interabdominal catastrophes, like twisted gut, appendicitis even in a really young infant, hernias that have twisted, the list kind of goes on and on. So we need to be kind of careful about these things. But if your child is not throwing up, if your child is eating well, your child is without fever, and your child is sleeping normally, you probably are dealing, your child is between 2 weeks and 2 months of age when it onsets, then this probably is typical colic. More importantly, I don't want to dwell on the diagnosis of colic. That's kind of my job as a physician. But what can you do for it at home? Because it is very, very frustrating. I think the most important advice I got when I was a resident was for parents of really colicky babies to get a babysitter. Once in a while, you got to get out and get a break from the colicky screaming baby, because this will stress out parents, and the more stressed out you are, your infant picks up on this, and it just amps that child up more, and you get into a vicious cycle. As mom and dad get frazzled to wit's end, the child becomes more irritable, more colicky, and it makes things worse. Getting a break once a week to get out of the house for a few hours makes a tremendous difference for the colic of the baby. There are some other things that we can do. Sometimes taking the child for car rides helps, and that often settles them down and they calm down and fall asleep. Kids who have interabdominal disease, pathology, catastrophes, twisted guts, they get worse in the car, not better in the car. So if your child is falling asleep in the car, that suggests that maybe this is colic. Sometimes putting your child in their car carrier, putting a non-skid mat down on top of the wash machine or the dryer and running a load of laundry helps to calm the child down. Some children respond really well to the noise from vacuum cleaners. I don't understand that one, but they do. My godson's parents burnt out a vacuum or two, keeping their son calm. Medication-wise, there are some things people have tried over the years. There is no good cure for this. A lot of parents try the infant gas drops. Now, gas does not cause colic. However, if your child is screaming a lot, he or she will swallow a bunch of air. If they swallowed a bunch of air, now they have gas, and as their belly starts to distend with gas, they become uncomfortable, making them scream more, and again it becomes a vicious cycle. Using the over-the-counter gas drops, Mylicon, simethicone, little tummies, does help. There is a substance called infant gripe water that a lot of parents try and swear by. There's not a lot of research surrounding that one. It seems to be generally safe. It's not something I necessarily recommend for my patients. Talk to your doctor before trying that one out. Another one that's very popular among my patients, because I care for a large Latino population, is Manzanillo or chamomile tea. In small doses, it is effective and it is safe. You do need to be careful. There's no calories in chamomile or manzanilla tea. There's no salt in there. Too much water for a baby is dangerous, so we need to limit the amount of water that the baby drinks, consequently the amount of tea that the baby drinks. But it does work to a point. Also available over the counter in a lot of pharmacies and grocery stores are teething tabs. In particular, the ones made by a company called Hyland, Hyland. The Hyland teething tabs have a couple of ingredients in it, but the big ingredient is extract of chamomile or manzanilla. And these tablets are very effective. And they can just be dissolved on the tongue of even a little bitty infant, or dissolved in a teaspoon of breast milk and dripped into the infant's mouth so that it's not a choking hazard. These work very well and are something well worth trying, and I strongly recommend to my patients. Hopefully you're not dealing with a colicky infant, because it's no fun. My heart does go out to you if this is happening. If you are, hopefully these suggestions will help you, give you some ideas, things you can try. If you're not sure what's going on with your infant, please give us a call. We're happy to see you at my office, 775-359-7111. We'll see you next time.